My name is Max Lebow. I'm very grateful for the opportunity to run again for the Board of Directors of the Urgent Care Association. As I was preparing this talk, I pulled up my nominating speech from the first time I ran for the board in 2017. At that time, I talked about all the changes in the healthcare system and how urgent cares needed to adapt. However, when I look from my vantage point of 2020, I realize I hardly knew what change was when I said those words 3 years ago. For urgent care centers of this country, the great pandemic of 2020 has been a very difficult time, but then in some ways it's been some of our best times. In March and April, most of us saw our patient volumes decrease to historic low levels. Most of us found that our centers were unprepared to keep our staff, patients, and even ourselves safe. It looked very bleak during those first 2 weeks. However, in record time, urgent care centers across the nation began to respond. Each of us, in our own way, through ingenuity and creativity and hard work, found ways to keep our patients and staff safe. Many of us adopted telemedicine programs to replace volume and see patients that were sheltered at home, filling the gap left by private doctor offices that were closing. Urgent care centers also have led the way for testing of both individuals and businesses, and are currently playing a major role in the reopening of America. More than ever before, urgent care centers are recognized as one of the important pillars for which healthcare delivery stands, not only during these difficult times, but from this time forward. I hope that the membership of the Urgent Care Association will return me to the Board of Directors for another 3-year term. Usually, this is the point at the talk when I speak about all the things that I expect to do over the next 3 years. However, if I've learned anything over the past 4 months, is that I can't predict what the next 3 years will bring. However, I do want to continue to help shape our shared urgent care future. As our conferences move online, our education becomes virtual, and Zoom becomes our handshake, I hope that you see the value in the membership of the Urgent Care Association, and that you will allow me to represent those interests in this year's election for another 3-year term. Thank you.